I'm Lauren. I'm the registered nurse that's going to be conducting this physical exam. My patient here has given me consent to perform the assessment, but I will reiterate, if at any time you wish to stop the assessment or you don't want to progress, just let me know. Also, if you have any pain or tenderness in any of your areas, please let me know as well. There were no abnormalities on the patient's history that we should highlight during this exam. We will maintain privacy throughout the exam, and confidentiality will remain between myself and my instructor. Let's get started. So the first thing we're going to do is just take a look at the skin on his face. There are no lesions or cuts or bruises. Contour is symmetric. We're going to take a peek at his scalp here. Any tenderness?
No, ma'am.
Okay. Hair is evenly distributed among his scalp. There are no masses or anything abnormal noted on the scalp. We're going to make our way down, and we're going to check his temporal arteries here. They're even bilaterally. They're not weak or bounding, but they're normal. He's got a symmetric expression on his face. Everything appears normal. I'm going to move on down to our T and J. So we're going to have you open and close. Any pain? Okay. So there was no clicking, which indicates that it's normal. So next we're going to do our cranial nerve 5. So I'm going to have you clench your teeth really hard. Clench your teeth really hard. Okay, and try to open. Okay, so he's able to open with resistance. So cranial nerve 5 is intact. Next we're going to check our the sensory of your face. So if you'll close your eyes, when you feel this on your face, just let me know.
Yep.
Okay. Next we're going to do cranial nerve 7. So we're going to have you smile really big, frown, puff your cheeks out. Very good. Any difficulty with that?
Nope.
His facial is symmetric on both sides. So cranial nerve 7 is intact. So now we're going to have him do the cranial nerve 2. So this is our visual acuity. So we're going to have him take a look at our Snellen chart here that we have posted. It is 10 feet away. So we're going to have him stand and read. So we're going to have you cover one of your eyes.
Okay.
Read the lowest line that you're able to out loud.
D, E, F, P, O, T, E, C.
Okay, now uncover and then cover the other.
Okay. D, E, F, P, O, T, E, C.
Okay, 20/20. Go ahead. Patient doesn't wear glasses or contacts. He did have LASIK eye surgery in the past. So now we're going to continue to look at our eyes. So we're going to check accommodation. So if you'll look at my finger. Okay, and now follow. Good. Okay, the patient's able to follow with accommodation as well as the different areas of sight without using any extra ocular movements, indicating that it's normal. So now next we're going to check his pupil reaction to light. Okay, good. They're about a 4, so the pupils were round and reactive to light. So we're going to go on down and keep looking at his eyes here. His conjunctiva is pink. Sclera is white, iris is brown, and pupils again were reactive to light. So we're going to look here at our eyebrows. Any pain?
No.
Eyebrows and eyelashes are evenly distributed on the patient's face. Any pain with eyelids? Okay. We're going to go ahead and look at your frontal and maxillary sinuses. So let me know if there's any tenderness. Any tenderness?
No.
Okay. Let's see. Next, we are going to inspect and look at your ears. So, do you have any pain?
Nope.
Okay. There's no discharge or bleeding noted on the patient's ears. We will conduct a cranial nerve 8, which is a whisper test. So, we're going to get about arm's length apart, and I'm going to whisper a word if you'll repeat it.
Blind.
Okay. And again.
Glass.
Very good. Cranial nerve 8 is intact. So next we're going to check the nose. So we're just going to inspect it. Any pain? The patient hasn't had any nasal surgeries or reconstructive and has never broken his nose. It's midline and symmetric. Can you close one of your nostrils and breathe? Good. And do the other. Any difficulty?
Nope.
Okay, so that indicates patency within the patient's nostrils. Next, we're going to go on down and look at the patient's mouth. So we're going to have you say, open your mouth really big. The buccal mucosa is pink and moist. The teeth are intact, none are missing, none are cracked. The tongue is pink and moist. The gums are pink and moist. The hard and soft palate, can you raise your tongue? Hard and soft palate are noted. We're going to go ahead and have the patient, we're going to check cranial nerve 9 and 12. So we're going to have you say, ah. Uvula rose appropriately. We have no no tonsils to assess. We're going to go ahead and check your gag reflex. So open up. Okay. Gag reflex is intact. We're going to also go on down to, we're going to have you stick your tongue out, move it side to side, up and down. Any difficulties with that?
Nope.
Okay, good. Next, we're going to look at our lymph nodes. So I'm going to come behind you, and we're going to go ahead and palpate the prearcural, okay, postarcural, occipital, submental, submandibular, tonsillar. Any pain with that? Let's see, posterior cervical, deep cervical, and supraclavicular. Lymph nodes are not palpable, which is normal, so it's not indicating any inflammation or tenderness at this time. So we're going to test our cranial nerve 11. So we're going to have you lift your chin to your chest. We're going to come back up to normal. Now we're going to hyperextend back, come back to normal. Now we're going to turn right and left, okay? And we're going to go ear to shoulder. Good. Other side. Okay. Now look my way. Now turn to your left shoulder. Okay. And then do the same. Good. All right. Shrug your shoulders up and down. Okay. Now shrug. Good. Patient's able to turn and shrug with resistance easily. Next, we're going to palpate. We're going to check your trachea. So, let's see. Do you have any water? Okay, so would you hold your cup of water? Okay, so we're just going to palpate the trachea here. It's midline. All right, can you take a sip of your water?
Mm-hmm.
That's fine.
Mm-hmm.
Swallow. Good. Any difficulty swallowing?
Mm-hmm.
Okay. Now check your thyroid. I'm going to come in front here. Any pain? Okay. Trachea is midline to the patient. All right. So next we're going to look at your carotid pulse. We're going to go one at a time here. Okay. Normal. Neither are bounding or weak, but they are normal. And next we're going to auscultate for any bruits we may hear with the bill of our stethoscope. No bruise is indicated here. Okay, next, do you mind lifting or taking your shirt off?
Yep, that's fine.
And then if you'll turn around
Yep.
and sit backwards in your chair. Okay, so we're just going to take a look at the patient's back here. It seems symmetric. There's nothing abnormal in shape or the patient's not using any additional accessory muscles to breathe. Patient's breathing at a normal rate. Laterally, the patient's not using anything, nor is there any disformation there. Okay, so we're just going to feel around to see if you have any pain. We've got some freckles, but there's nothing abnormal noted. Is there any pain?
Nope.
All right, so we're gonna check for our tactile primitus now. So I'm gonna have you say 99.
99. 99.
Okay.
99.
Okay.
99.
Good. So vibrations were equal bilaterally. Was there any pain with that? Okay. Good. So now we're going to percuss over the lung fields. So we're looking for resonant sounds. There should be no dullness. Good. Okay. Next, we're going to percuss over the costovertebral angle for any flank pain. Any pain?
Nope. Nope.
Good. Okay, now we're just going to take some listen to his breath sounds. So deep breath in. Okay. Good. All lung fields are clear. Did you have any difficulty breathing?
Nope.
Okay, good. So if you'll just turn around for us and face the front, we're going to check your upper extremities. So just looking at your arms here, do you have any difficulty using your arms?
Nope.
Do you have any pain in your arms?
Nope.
Good. So we're just going to take a feel of your pulses. Okay, so radially, you can relax. And your ulnar. Good. And your brachial. Okay. Good. These are equal bilaterally. Not bounding or weak. Okay. We're going to assess your capillary refill. So if I have your fingers. They were both brisk and less than 2 seconds. Okay. So now we're going to test the range of motion of your shoulders. So can you raise your arms up tall? Can you go behind your back? Good. Any pain or difficulty with that?
Nope.
Okay. We're going to have you abduct, take away, and then adduct to bring them back in. Now we're going to do bend at the elbow, straighten, bend again, and straighten. Good. He's able to do it with resistance easily. We're going to have you flex up your wrist, straighten. We're going to have you ball up your fist, open, wide. Now we're going to have you touch each finger individually to your thumb. Okay, very good. Now we're going to test the cerebellar function, arms out wide. We're going to go finger to nose, alternate with arms, and then get faster. Good. Okay, no difficulty there. Very good. So we're going to do our graphesthesia and serogenous now. So I'm going to draw like a letter or a number, in your hand, and you can just repeat it back to me. Close your eyes. Okay?
9.
Yes. All right.
3.
Yes. Very good. Okay. Next, I'm going to have you test an object in your hand. If you'll just tell me what you think it is.
Rubber band.
Yes. And then we'll go with the other hand.
Feels like a coin, probably like a quarter or something.
Okay. Yep. Quarter. Very good. Okay. So we're going to go ahead now and transfer you over to lying down. So if you'll follow me.